up yesterday with hitting?
Awesome.
Yeah.
I was hitting the ball harder than I do, and I wasn't even
Nice.
swinging
Nice.
full. Yeah.
I really like hearing that, man.
Yeah.
That's gotta feel good.
Yeah. So about 2.5 months ago, I would say I started having some minor oblique pain, and so I shut down swinging and stuff.
Yep.
And then rehabbed that back a little bit, maybe rushed it a little bit, and then pushed it.
You're trying to play though.
Yeah,
right?
trying to get healthy.
Yeah.
And it was feeling good, so then I kind of pushed it on back squat, and my muscles in my back kind of got strained.
Yep.
Whatever.
So real quick, just to comment on what he just said right there. This is a very common problem that we end up seeing with everyone from athletes and weekend warriors to people that work at home, people on the job site, people working from the office, where the problem starts to get to where it feels a little bit better. So they push it and they try doing things that they haven't been able to do in a little while. Next thing you know, the problem is back, right? It's because the problem never got fully resolved, and then it didn't get fully resolved. So they went back to doing the things that they were doing, and the problem then resurfaced and re-showed itself. We got to make sure that we get the problem fully corrected first. How'd that hold up yesterday with hitting?
Awesome.
Yeah.
I was hitting the ball harder than I do, and I wasn't even
Nice.
swinging
Nice.
full. Yeah.
I really like hearing that, man. That's gotta feel good.
Yeah.
So a lot of times these intercostal muscles that you see me working on here, they can really be a big problem because it can affect everything from how you breathe and how you move and how your activities that you're performing and everything else. So we need to get in there and break it up. So if you imagine that those ribs are in between there, those muscles in between those ribs, if these are the ribs, we have to work on those sometimes. Now the same thing can happen with everything from not only the intercostal muscles, but the erectors and everything else, the spinal erectors, which we'll show that here in just a moment. But just to kind of give you a point of reference. Shoulder hold up with hitting and everything?
Good.
No problems.
Yeah.
Good. So I'm asking that because I understand the compensations of the lumbar spine, shoulder, and wrist, and understanding the biomechanics of my patient. Chin up from this one. Good. There we go. There we are. So now we're just doing a really quick something to help with the lats, traps, erectors. The trainer is actually doing a lot more of that. Man, that's great news that you were able to be hitting like that and it didn't bother you at all.
Yeah, it was really cool.
I love that. Did you get a chance to connect with your trainer?
Yeah.
Good.
Yeah, definitely the best it's felt since the injury.
Good, man.
So, I think good going in there.
I have a lot of fond memories in working with the Cardinals, and one of those was talking with Mark McGuire. And Mac would talk about how everything comes from your legs and your pelvis and your foundation from there up. That's where you get your power in hitting, right? So he's got a lot of home runs. He knows about hitting. So I like to make sure that for everyone, from my athletes to my parents to my, my people working at the office, that foundation is functioning like it's supposed to, because I see that biomechanically too. Perfect.
Awesome. Thank you.
You're welcome.
Yeah, definitely. I can feel that I used it, but
Probably
definitely feels
just
way better than
what it has been.
Yeah.
Nice. That's what we like to do.